Good day all, this is Alpha 1, Case 1, left femur closed fracture. Today I'll be showing you the procedures to aid and rescue someone who's injured in an earthquake and the victim present with left femur closed fracture. As you can see, there's a young lady falling to the ground during an earthquake and accidentally hurts her left leg. Aftermath, there is a rescuer who comes to check her condition, looks for vital signs like pulse, such as radial pulse and carotid pulse, breathing and level of consciousness, and immediately call for help. More rescuers arrives, makes the patient conscious, position the patient correctly with minimal damage, and ask for a site of pain and brief the casualty. Inspect the patient and determine any other injuries. Uses normal and easily accessible things around us like broomsticks, umbrella, plastics, cloth, and more to improvise to treat the patient. In this case of left femur fracture, splinting is recommended. So there are a few guidelines for splinting. First, perform circulation, motor function and sensation, which is CMS. Secondly, warn victim of pain. Third, support above and below injury site. Fourth, splint in position found. Fifth, apply firmly but do not affect circulation. Sixth, do not try to realign bones. 7, recheck CMS, which is circulation, motor function and sensation. And finally, secure to body for additional support. Once done with splinting, make sure it's neither too tight nor too loose. Remember to have a leader among the rescuers. Firstly, the leader will position the assistants, reach under the victim and grasp one waist on the opposite rescuer. The rescuers on the ends will only be able to grasp one wrist on the opposite rescuer. With only one wrist grasped, the free hands will be used to support the victim's head and feet or legs. The rescuers will squat and lift the victim on the command of the person nearest the head. Remember to use proper lifting techniques to avoid any further damage to the victim. It must be a simultaneous upward lift and the movement with the victim head forward. The same foot movement simultaneously. Here we are using the hand hammock method to carry the victim. Thank you.
Penetration wound of right eye.
As you can see, there's a patient with an object penetrating his right eye and left arm injury. As soon as the bystander arrives, he asks for the victim's well-being and ability to move or not. The victim responds no. The rescuer checks for vital signs like radial pulse, breathing, consciousness level, and immediately calls for help. More rescuers arrive, checks for the patient's site of pain and brief the casualty, inspects the patient and gets to know injury sites, inform the patient about the procedures and make sure it's done carefully. Firstly, covers the wound with donut bandages and tie them around the head with the help of other assistant. Most of the things used are simple and easily accessible things like cloth, triangle bandage and blanket. Now I would like to show you some footages on how to do donut bandage, which is very easy and quick.
Fracture of left radio ulna.
Lines for splint and sling. It is recommended for this patient. First, perform circulation, motor function and sensation, CMS at the fingers. Second, elevate and bend the injured left arm gently to the medial part of the body. Third, splint is in position found. Fourth, apply firmly but do not affect circulation. Fifth, slide the triangular bandage underneath the elbow of injured arm. Sixth, bring the top end of the bandage around the back of the neck. Seventh, fold the lower end of the bandage to the top of bandage at shoulder of the injured arm. 8. Tie the two ends together above the collarbone. 9. Adjust the sling so it supports the arm all the way to the little finger. And finally, recheck for circulation, motor function, sensation at the fingers again. Once done, place a big white blanket on the ground, ask the patient to get up and assist to lie on the blanket gently. The leader will command all the other assistants to take their positions on all sides of the blanket in order to carry the patient. Roll almost the blanket to the patient. The leader command to uplift and lift upward simultaneously. Make sure the movement with patient's head forward and the same foot movement of other assistants simultaneously. Cover the patient's head with a blanket and use it as the head stabilizer.
Action.
1, 2, 3, down. One, two, three, up.
This method is called blanket hammer carry.
Penetration wound at abdomen. Firstly, ensure the scene is free from danger. Call out to the patient and check for consciousness. Ask the patient if they're able to move their limbs and check for a pulse. Then, shout for help. Do not remove any foreign body penetrating the abdomen. Place a donut or ring pad around the impaled object. Use a roller bandage and cover the ring pad as much as possible, and lastly, secure the bandage above the wound. Laceration wound on palm. First, wash your hands thoroughly with soap to avoid infection. Next, wash the cut with mild soap and water. Apply direct pressure to stop the bleeding. Apply an antibacterial ointment to coat and protect the wound. Once the wound has stopped bleeding, cover it with a clean and sterile bandage. Adjust the length of the stretcher. Then, lift the patient simultaneously and at the same level. Position the stretcher underneath the victim and lie the patient on the stretcher safely. On the count of 1, 2, 3, the patient is lifted and transported out with the patient's head position is in the front. Spinal injury with tetraplegia. Firstly, ensure the scene is free from danger. Call out to the patient and check for consciousness. Ask the patient if they're able to move their limbs and check for a pulse. Then, shout for help. Remember to introduce, assess site of pain, brief casualty, and inspect any other injuries. Firstly, the head should be immobilized with cervical collar. Gently align the patient's head to a neutral anatomical position and measure the distance between base of chin to suprasternal notch. Slide the collar under the patient's neck and mold the collar around the patient's neck. Position long spinaboard and assistance to lift the patient. Roll the victim toward the assistant with one person giving mild traction on the patient's head. The spinaboard should be slide into position and position casualty on board. Immobilize the patient by securing the patient's chest firstly. Then secure the patient's knee followed by the patient's foot. Then, secure the patient's head. The assistants should be positioned near the patient. On the count of 1, 2, 3, the patient is lifted simultaneously and can be transported out with same foot movement, and the patient's head position is in the front. Thank you for watching.